Video lecture chapter 19, disease transmission and infection prevention. The dental assistant is at risk of exposure to disease agents through contact with blood and other potentially infectious material. By carefully following infection control and safety guidelines, you can minimize your risk of disease transmission in the dental office. So the chain of infection has four parts: virulence, number of microorganisms, a susceptible host, and a portal of entry. All four parts must be present in order to have infection. Virulence refers to the degree of pathogency or strength of that organism and its ability to produce disease. We cannot change the virulence of microorganisms, so we must rely on our body's defenses and specific immunizations. Avoid contact with microorganisms by always using infection control techniques. Number of microorganisms. Pathogenic microorganisms must also be present in large enough numbers to overwhelm the body's defenses. Number of pathogens may be directly related to the amount of bioburden present. Bioburden is organic materials such as blood and saliva. The use of a dental dam and high volume evacuation helps minimize bioburden on surfaces and reduce the number of microorganisms in the aerosol. We also must have a susceptible host. This is a person who's unable to resist infection by the pathogen. An individual who is in poor health, chronically fatigued, or under extreme stress, or who has a weakened immune system is more likely to become infected. By staying healthy, washing hands frequently, and keeping immunizations up to date, we can resist infection. A portal of entry must be present to cause infection. A pathogen must have a portal of entry or a means of getting into the body. The portals of entry for airborne pathogens are the mouth and nose. Bloodborne pathogens must have access to the blood supply to gain entry into the body. So this could happen through a break in the skin, like a needle stick cut, or even a human bite. Types of infection. Acute infection. Symptoms are often quite severe and appear soon after initial infection occurs. Chronic infection. The microorganism is present for a long period, sometimes for life. Latent infection. A persistent infection in which the symptoms come and go, as in cold sores. An opportunistic infection caused by normally non-pathogenic organisms. Opportunistic infections occur in individuals whose resistance is decreased or compromised. Modes of disease transmission include direct transmission. So this occurs when somebody comes in direct contact with the infectious lesion or infected bodily fluids. Indirect transmission involves the transfer of organisms to a susceptible person through, for example, the handling of contaminated instruments or touching the contaminated surface and then touching your face, eyes, or mouth. Airborne transmission, also known as droplet infection, involves the spread of disease through droplets of moisture-containing bacteria or viruses. Aerosol spray or spatter contain saliva, blood, and microorganisms and are created with the use of the high-speed handpiece, air-water syringe, and ultrasonic scaler during dental procedures. Mist are droplet particles larger than those generated in aerosol spray. Spatter is large droplet particles contaminated with blood, saliva, and other debris. This happens during dental procedure when the mucosa, eyes, or mouth, or indirect skin is splashed with blood or blood-contaminated saliva. Parenteral transmission can take place through a needle stick injury, bite, cut, abrasion, or any break in the skin. Blood-borne transmission involves direct or indirect contact with blood or other body fluids. Food and water transmission occurs when contaminated food has not been cooked or refrigerated properly, or water that has been contaminated with human or animal fecal material. Fecal-oral transmission occurs when proper sanitation procedures, such as hand washing after the use of the toilet, are not followed, and one of many pathogens present in the fecal matter is transmitted when the infected person touches another person or makes contact with surfaces or food. The immune system. The human body receives resistance to communicable diseases from the immune system. A communicable disease is one that can be transmitted from one person to another or by contact with body fluids from another person. Inherited immunity is present at birth, and acquired immunity is developed over a person's lifetime. Naturally acquired immunity occurs when a person has contracted and is recovering from a disease. Artificial acquired immunity or antibodies are introduced into the body by means of immunization or vaccination. Every dental office should have an infection control program designed to prevent the transmission of disease from patient to dental team to patient to patient, dental office to community, and community to the dental office to the patient. Patient to dental team is the most common route through direct contact touching of the patient's blood or saliva. Droplet infection occurs through mucosal surfaces of the eyes, nose, and mouth. Indirect contact occurs when the team member touches a contaminated surface or an instrument. Patient to dental team continued ways to prevent disease transmission from patient to dental team member is by using gloves, hand washing techniques, masks, rubber dams, and mouth rinses. Dental team to patient is very unlikely to happen, but can result if the dental team member has lesions on the hands or if the hands are cut while in the patient's mouth, permitting the transfer of microorganisms. Infection control measures to help prevent team to patient transmission include masks, gloves, hand washing, and immunization. Patient to patient has occurred in the medical field, but no cases of this type of transmission have been documented in dentistry. Although such transmission is possible, contamination from instruments used on one patient must be transferred to another patient for this to occur. Infection control measures that can prevent patient to patient transmission include instrument sterilization, surface barriers, hand washing, gloves, and the use of sterile instruments. Dental office community. Microorganisms can leave the dental office and enter the community in a variety of ways. Contaminated impressions that are sent to the dental laboratory, contaminated equipment that's sent out for repair, in theory, transportation of microorganisms out of the office in the dental team's clothing or hair. The following measures can prevent this type of disease transmission: hand washing, changing clothes before leaving the office, disinfecting impressions and contaminated equipment before items leave the office. Community to dental office to patient transmission. Microorganisms enter the dental office through the municipal water that supplies the dental unit. Waterborne organisms colonize the inside of the dental unit, water lines, and form bioburden. As water flows through the handpiece, air water syringe, and ultrasonic scaler, the patient could swallow the contaminated water.